Hi, Dr. Manal. You're muted.
Okay, my dear, give me 5 minutes, yeah?
Okay, thank you.
Hello. Hi, guys. Do you hear me?
Yes.
Hi, Dr. Manal. Yes.
Sorry, guys, for being late. So thank you for waiting. And I miss you very much. How are you? How is everyone doing? Huh?
We're doing okay.
We're breathing and surviving.
Dr.
You're
Manal,
trying.
I have a
You're
question.
barely breathing. Yes.
For this session, is it possible if you can record it so we can review it later?
I can record it, as I said before, Justin.
Mhm.
But the thing is, I don't know how to share the recording because I tried to record it before,
Mhm.
but I'm not sure how to share the recording. Are you going to be here on campus tomorrow?
I don't think so, but if you send me the recording, I can probably upload it and send it to everyone.
Okay, I'm going to record it, but
Okay.
I'm not sure how to send or how to even do anything about it. So I'm going to record it. It doesn't matter to me. And also, I'm going to share the PowerPoint, the whole slides, because I really want you to do very well in your exam 3. We need these points, okay? So I'm going to share the slides after, and I'm going to break it down together. So when is exam 3 again? What day?
Thursday?
This Thursday. And then your HESI exit,
Next
right?
Wednesday.
Yeah, and the final for maternity peds.
Next Wednesday.
Next Wednesday as well.
So Wednesday, you have 2 finals, HESI and maternity peds.
No, 11:50 final is this Friday.
This Friday.
Oh, right.
So exit is this Friday. Exit 2 is this Friday. And then the maternity peds final is Wednesday. Okay. So today we will break down exam 3, which is Thursday. And Thursday we will break down exit, HESI exit, which is for Friday. But as usual, I don't like you to wait last minute. So I'm going to share some notes for exit today. I'm going to send it to you guys for the exit exam. But I will not talk about exit today. I will just share the notes so you can start studying these notes. Exit is not anything other than you prepare yourself by practicing comprehensive exams. Do you remember the 3 comprehensive exams I gave you on the case study ebook? Yeah? I give you access to these ebooks. Yes? Yes, Benikar said yes.
Yes, I believe so.
Yes, it is not Saunders. It is a case study, Justin. Case study, it has 3 comprehensive exams. The 3 are very good in the case study book. Yeah. So let me see how I recorded this. So exit, guys, I started to record everyone. Okay, everyone agree that we are recording this session? Yes?
Yes.
You consent. Okay. So that will be recorded. And as I said, I'm not sure how I will share this link. I will do my best to send it to you, Justin. And yeah, but you guys don't rely on or don't give hope. It will be recorded and you have it fully. I want you to focus with me right now. Deal? Yeah. So we will do exam 3 review right now. At the end, I'm going to provide you with exit 2 notes. Again, any notes is not a guarantee for this will be in the exam. It is just our effort to show you this is high yield. Please review these concepts. The main thing is to practice, practice, practice. And I give you access to the comprehensive exams via Unfolding Case Study ebook. And I give you also the guideline on how to use Saunders. So you have many resources. Plus the Burgundy book, it has also comprehensive exams. It has comprehensive exam A and the comprehensive exam B. The more questions you work on, the better score you will get. Plus confidence, guys. You have been studying all term. You have been taking many exams. You have been attending tutoring. So gain trust, trust your capability. If you go hesitant, it will take from your performance. And please don't think that I scored bad in exit 1, so I'm going to score bad in exit 2. This is not the case. Most of the people score not the best in exit 1 and they do very well in exit 2 because it is different. You got exit 1 and you just came from term 4. You have no idea what comprehensive exam will be. Exit 1, it had many maternity, many peds, and you didn't study maternity peds before exit 1. Now you have full understanding of maternity peds. So it is completely different. Please forget your exit 1 score if you're not satisfied with this score. It is completely different. You're a different person right now. You went through many exams, many quizzes. You have been studying. You have been listening to us. You have been more focused. So trust that you will do good. Yes? Try. Let's give it yes, because without the positivity, without being confident about yourself, how I will perform well, that will take from my performance if I'm not confident. Okay. Let's just start exam 3. We said exam 3 right now. So I prepared a very neat PowerPoint for you guys. I want you to understand how the exam 3 will be. Exam 3, it will be on cardio. And this is not the first time, by the way. We reviewed exam 3 together before, right? We reviewed cardio. Yes? Did we? Did we review cardio? We reviewed RISP, and I told you there will be tons of questions on RISP in this upcoming exam. So make sure you're good in this. We reviewed hematological disorder, blood disorders. We didn't review GI, we did not review INTEG. So I reviewed with you cardio, RISP, hematology, these 3. Yes? We will visit them again fast after we finish GI, INTEG, and endocrine. So your exam will include all these: cardio, RISP, hematology, GI, INTEG, endocrine. And the PowerPoint I'm going to share with you is this PowerPoint. It has heart first. You will see congenital heart diseases, the ones we discussed last time. After that, you will have the respiratory. So it is divided by systems. You know what I mean? Divided by system. So we reviewed that. We reviewed cystic fibrosis. We went over it, but we did not review gastro, right? Remind me, guys. It has been a long time. We did not go over gastro. Yeah? So gastro. Let's start by gastro, then endocrine, then integumentary, then some safety. After we finish these, we will review cardio again, hemat again, respiratory again. Yes? This review is very focused. As Ms. Tina mentioned, it will be exam focused. It will be very condensed review. Gastro, guys. Ready? Are we ready for that? Yeah?
Yeah.
Do it. Okay, gastro. We will study GERD, we will study gastroenteritis, we will study intussusception, pyloric stenosis, Hirschsprung, hernia, so gastrointestinal disorder. First one, let's talk about the GERD. Sometimes people, like newborn, poor them, they born with loose sphincter. So normally we have the esophagus, then the stomach, right? This sphincter in the lower esophagus, we have lower esophageal sphincter. If this sphincter loose, if it is loose, GERD will happen. The stomach content will back up to the esophagus. This is the heartburn. So how we can treat this in infant? Somebody just have breast milk. The only treatment we give thickening, or we thicken the formula or thicken the breast milk with cereals. The more thick the breast milk or the more thick the formula, that will decrease the GERD. What else? We need to hold that child upright for 2 hours. Don't put them supine for 2 hours after the feeding. Give your cat a hug. Give it a hug. Don't put it away. Put it in your lap. So this is GERD. Then if you have a choking infant, how you hold them? Hold the head down and give the infant 5 back blows. Hold them down, the head is down, and then give 5 back thrust. If you have a patient with diarrhea, vomiting, diarrhea plus vomiting, we call him gastroenteritis. Gastro is the stomach, enter is the intestine. So together the stomach and the intestine inflamed, we call it gastroenteritis. If the stomach is inflamed, it will cause vomiting. If the intestine is inflamed, it will cause diarrhea. So gastroenteritis is vomiting and diarrhea. Do you think people with vomiting and diarrhea, they lose fluid? Yeah? Fluid loss is a problem. So there is risk of dehydration. Yes? How to calculate the output in an infant? How to know the amount of output? How do you know how much fluid? Yes, weight or weigh the diaper. You need to weigh the diaper. Empty diaper, we know it is 50 grams. Then whenever they have urine, you weigh the diaper so you know how much urine they lost. Plus, you know the input, you know how many fluid, how many ounces you give. So input, it should equal the output. If the output is more, that will put them in dehydration. Correct? So we need to stop this diarrhea from happening. What kind of diet we offer for person with diarrhea? BRAT, the BRAT diet. B4, yeah, B4, bananas. R4, yeah, interactive, guys. R4,
For potassium, R is
B banana, R.
rice, apples, and toast.
Yes, very good. Apples and toast. Yes, so give banana and rice. Give apple and toast. Yes, Carolina, good job. Banana, rice, apple, toast. Then Hirschsprung. Hirschsprung disease. Again, it's They born with it. They born with this disease. It is congenital disease. So caused by what? Look, this is a normal intestine. This is the colon, the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anal canal, anus. So it is called, why this is abnormal? Look at this. What is abnormal here? What do you see abnormal?
Inflammation.
It is what tells you there's inflammation. There is no inflammation in Hirschsprung. You see this part is swollen. Do you see this part is swollen, right? And this part is very narrow, right? So the narrow part, this narrow part, why it is narrow? It is not like this, because there is absence of parasympathetic ganglion cells in portion of the colon. So this portion, this tiny portion, this one, there is no ganglion cells. So it's not expanded like this part. So look at this part, this is normal. This part is narrow because there is absent ganglion cells. Yes, if it is narrow, the stool will not go through, right? The stool will be accumulated back. That's why this is swollen. The swollen part is, this is part of normal intestine. It got swollen because the stool impacted in there, because the stool cannot go down. This is Hirschsprung. So what is the reason of Hirschsprung? I want to hear from you or type it on the chat. Cause of Hirschsprung. Give me the answer. No ganglion. Good job. No ganglion. It is not telescoping macula. Macula, the telescoping is intussusception, not Hirschsprung, because you need to know the difference. The Hirschsprung, as Justin put, absence of the ganglion. So the lower part is very narrow. The proximal part will be swollen, filled with stool. So when this kid started to have bowel movement, how the stool will look like? If the stool goes through this narrow area, the stool will be like narrow like this, right? And it will twist like this. It will be long and narrow. So it looks like what?
Ribbon-shaped.
Ribbon-shaped stool. So Hirschsprung, they born with it, so it is congenital. Why they born with it? Because absence of the parasympathetic ganglion in portion of the colon that cause ribbon-shaped stool. How they treat this? Surgery. Just surgery. Fix this, okay? So this is Hirschsprung. Next disease is pyloric stenosis. What is pylorus? Let me put you drawing here. Esophagus, stomach. And from the stomach, there is a sphincter. It goes to the intestine. Okay, so this is the intestine. So there are two openings here. One at the beginning of the stomach, one at the end of the stomach. Which one is the pyloric sphincter? Number 1 or number 2?
Number 2.
Number 2. Number 2 is the pyloric sphincter. So pyloric stenosis is narrowing of this pyloric sphincter. It is narrow. And as you see in here, it is very narrow because it is hypertrophic. Hypertrophic pyloric stenosis means enlargement of the sphincter. So it will be very narrow, like a pinhole. So when the child get breastfeeding, milk goes down, but the milk is not going to the intestine. The milk will stay longer in the stomach because there is no enough room for the milk to go down. There is no opening for the milk to go down. Yeah, so more feeding will cause more milk. So fermentation happen, gases will start to be in the stomach, high pressure in the stomach. Then, ouch, look at this. What happened now? It is what is the name of this? Vomiting.
Projectile vomiting.
Projectile. Yes, projectile vomiting. Is Esmeralda still can't join? Marissa, Esmeralda. Yeah, Marissa, Esmeralda, are you here? Is Marissa here? May you guys send them the link? Because
I am
Marissa,
here.
okay. You're Marissa, right?
Yes.
And Esmeralda, are you here, Esmeralda? Esmeralda missed it.
She's here.
Okay. Okay, so this is a projectile vomiting. Okay. What do you think? They will have good, like, thrive, or they have failure to thrive if they keep vomiting?
Failure to
Failure to thrive. They will be hungry all the time, irritable all the time, right? And then assessment finding. When you do assessment of the abdomen, what you expect in the assessment? What is this? This is a pyloric sphincter, but it is enlarged, it is hypertrophied. So when you assess the abdomen, it will be, olive shape. You guys, why I feel you're not engaged? Why I feel you just off camera and I feel you're not engaged? Are you tired? I know you're tired, but I mean, if you're off camera, you will not be focused. Don't tell me I am 100% focused and you're off camera. And this is so precious, focused review for exam 3. I want you to take it all. I want you to don't miss any word. Trust me, every word I am saying today is crucial for your exam. Crucial means crucial, you know? So just give your full attention here. We will be done at 6 o'clock. So give me full attention, please. Okay. I'll give you a few minutes. I'll come.
Dr. Manal.
You're muted.
I understand, guys, you feel defeated, you feel discouraged. But if we feel defeated or discouraged, should we just give up or do our best? There is someone saying, I'm here to give you focused review. I'm here prepared you a PowerPoint. It has everything you need. Should I give it 100% attention? If you are even drowning and there is somebody give you a rope, are you going to hold this rope with your 2 hands, take it all? Or no, I am just drowning here. Yeah? So I will give you a couple minutes. I'll go do something really quick. There's a student here. I'll go do something really quick. 2 minutes. I will be back. I want you all to be on camera. Please. Please, all of you guys on camera. Okay? Please. Yes, I know you love me. I know you love me because I love you very much. I'm dedicated to help you here. And I can go above and beyond with you guys to make it happen, to make you pass. So first step now, let's take care of exam 3. Let's assure that we are ready to pass this exam with almost 90% minimum. Okay, I'll be back in 2 minutes.
Fine,
Make
please.
yourself ready. Hmm?
Dr. Manal, before you go, are you able to see my chat messages or no?
No.
No?
Who's-
Okay, I've been typing in the chat and
Thank you. Thank you for tutoring regard. You said thank you, right?
everything else, like all of like the little answers
Like,
before that.
oh, my camera. Because the chat is
Mhm.
hard to follow.
I apologize, my camera doesn't work, so I'm just trying to show that I'm
No
here
problem.
present.
No problem. Just
So-
talk. If you cannot, guys, do your camera, it doesn't have to be. If you're not comfortable, just talk, guys. Give me your voice. Make me feel you're here. Yes, I'll be back. Okay.
I like your statement, Carol. Thank you for speaking out. Right? Yes.
Yeah,
Reading.
that's how a lot of us feel, but
Hey, Raiden. This is what I was. What are you drinking? What are you drinking here? Something yellow. What is that? What is that?
Corona?
What is that? Seriously, we're on the recorded line here. You're in troubles. Red Bull?
No.
Okay.
Yeah.
If Red Bull?
Yeah.
Red Bull.
Okay, pour it. I want to see the color of the Red Bull. It doesn't look like a Red Bull.
It's yellow.
Okay. Okay, guys. Carolina. Yes. Oh, you put green color here. Yeah?
it's always
Yes.
been green. It's always
It's
been green.
always, but maybe you have it like up or something. I've never seen it down. Yes, yes. Okay. Okay, guys, let's make it. Let's make it happen. Let's make it. And Katie, yes, everyone is paying attention. Yes, thumbs up. Yes, okay, let's do it. So now we know what is pyloric stenosis, right? So what assessment finding when you do abdominal exam? What is the shape of the mass?
Olive shape.
Olive shaped mass. Yes, olive shaped mass. He might be dehydrated because he lose a lot of fluid. So what is your nursing care? Number one priority in patient.
Dr. Manal,
No,
you're muted.
number one priority, if somebody keeps vomiting, what is your number one nursing care?
To make sure that they don't aspirate.
Okay, prevention of aspiration. Justin, very good. What else?
Control the electrolytes.
Exactly. Make sure there is fluid electrolyte balance. Yeah, so check input, check output, check fluid and electrolyte balance, because lack of electrolytes could mess up with the heart. Like potassium is very important for the heart, calcium is very important for the heart. So take care of input, output, plus electrolyte. Okay, another disease, it is called intussusception. Michaela, this is the telescoping. This is the one when telescoping happen. So let's go back. Hirschsprung, what is the reason? Everyone, what is the reason for Hirschsprung disease?
No innervation, no
No
ganglions.
ganglion. Very good, very good. What is the reason of pyloric stenosis?
Thin, like very narrow.
Narrowing. Good job. Reason of intussusception.
When the
Teles-
muscle folds into itself.
Exactly. The intestine will telescope into itself. Intestine is like a tube. It's a long tube. Part of the tube is narrow. This part will go into the wider one. So telescoping. So intussusception is telescoping of the intestine. Look at the intestine. This is normal. Now, part of the intestine will get in other part. So telescoping, this is intussusception. This is sudden severe abdominal pain. The child is completely fine. They are not born with this. They born normal. Yeah, this is different than Hirschsprung. Hirschsprung, they born with it. But intussusception, it is accidentally happen. Let me give you example. A patient literally came to the ER with his kid, and he was like, I was playing with my son. He's 2 years old, and he was flying the son in the air, like playing like with him, flying in the air. You know how dads, sometimes they go crazy and play hard with their kids. So he was just flying the son in the air, and then he put the son on the floor to play with his toys. Few minutes after he put his son on the floor, the kid started to like twist his knees, screaming from the pain suddenly. So this is intussusception. Part of the intestine go into other part. It causes severe pain, sudden severe pain. The kid will be twisting his legs from the pain. This is emergency. We need to remove this intussusception to put it back to normal, to make it like, looks like normal. So what they try, what kind of intervention they try to push it back. So there is something here in this intestine telescoping, something telescoping. Can we push enema? Can we push air here from the anus to just correct the intussusception? Yeah, who agree? Who agree? Let's push air, so that might push here to correct it. Can we do that? Yes or no? It's a yes, Justin.
Yeah.
It's a
I
yes.
thought it was enema. Oh, I guess that also works. That also works.
Sorry? It works, yes. So they do enema. They do enema, my dear, and they might do barium enema, because barium also used for imaging. So they might push air enema to correct the intussusception, or they do barium enema because they want to see a picture, barium enema and then X-ray to show what is happening. Sometimes the intussusception resolved with the enema. It is corrected by the enema. If not corrected because it is emergency, why it is emergency? Because what might be cut because of this telescoping?
Circulation.
Circulation. You're cutting circulation from part of the intestine. So if it is not corrected, surgery is a must. Yes? And the very hallmark to diagnose is the stool. Stool is?
Jelly-like.
Yes, current jelly-like stool. This is a hallmark for intussusception. So sudden severe abdominal pain, vomiting, twisting the legs, once the small intestine or part of this intestine push into the large intestine. We can correct it by enema, either air or barium, if not surgery. Yes? So nobody is confused between Hirschsprung or pyloric stenosis versus intussusception. Yeah?
Yes.
Then hernia.
Dr. Mel, I had a question for
Sure.
intussusception.
Yes.
So you said it was the air enema and then the barium enema? It's like one's first and then
It doesn't
another second?
matter. It doesn't matter,
Doesn't
actually.
matter?
They will not ask you which one is first. You just know either or, whichever in the question, you pick it. Either air enema, yes. If it is barium enema, yes. They will not give you which one first, or they will not put both of them in the answers.
Okay, thank you.
How do you
You're
spell it? The
welcome.
barium? Like how do you spell it? The barium enema?
I will do barium important because barium is also for treatment, not only treatment, it is also to see the image, to diagnose the disease. So barium is important, but again, they will not ask which one. Yeah?
Okay.
Okay, then hernia, guys. What is hernia? Hernia is when intestine bulge out from a hole in the abdomen. Like if there is weak muscle, the intestine will bulge through a weak muscle. This is hernia, right? Where is hernia could happen? Could happen in the umbilical area, right? So we will call it umbilical hernia. It could be in any area in the abdomen where there is weak muscle, so the intestine will bulge out. Hernia sometimes is tiny, sometimes it is big, right? If it is tiny, should we just ignore it since it is tiny, or it has to be treated surgically? What do you think? You will be like, oh, fine, it's a tiny one. I can even push it back. Some patient, have you seen patients saying that? I can push my hernia back? Yeah.
It's not recommended though, right? Because like
It's
you don't
not.
know. Yeah.
Yeah, but sometimes they literally can push it back because it's something bulging when they cough, when they talk, when they strain, it bulges more. So easily they can push it back. But it has to, you have to recommend surgery, even if it is tiny, because complication could happen even with a tiny hernia. Like sometimes hernia is out like this, but now it is incarcerated in the opening. It cannot be pushed back. And if it is incarcerated, what will happen? This is cut off the blood supply because it is narrow around the hernia, so blood supply will cut. How I know there is cut of the blood supply? Look at the color. So changing in the color of the hernia is indication of cut of the blood supply. So any discoloration in the hernia, this is a very dangerous sign, need to be reported immediately. Don't try to do anything, just report it immediately because this is a complication called incarcerated hernia. Incarcerated hernia, it causes pain, it causes discoloration. This is emergency. You need to contact your doctor because this is cut of the circulation. It might be gangrene in the hernia very soon. Yeah?
Yes.
Yes.
So this is all about GI, guys. Easy? Yes? GERD?
Yes.
GERD?
Yes. That's
Pyloric stenosis, intussusception, Hirschsprung. Yes, these are
Yes.
the stars for our upcoming exam. Make sure you know them very well. Let's continue. Let's jump into renal and integumentary. Renal. Renal, there are 3 diseases. You may be asked on them. Number 1, nephrotic syndrome. Number 2, glomerulonephritis. Number 3, Wilms tumor. So 3 diseases, nephrotic syndrome. Let me change the color here. So nephrotic syndrome, glomerulonephritis, Wilms tumor. Yeah? For each one, there are kidney problems. Let's start by Wilms tumor. By the way, kidney, guys, responsible to regulate blood pressure because it has enzyme called renin, help to regulate blood pressure. So most of kidney issues, they will have hypertension. Kidney problems mainly cause hypertension. Yes, Michaela, you have a question? Because I see your hand up. So, oh, okay. I am showing slides. You guys, you don't see the slides?
I see it.
You see it. So who is not seeing it is problem from your end, my dear. So log out and come back. You may log out and come back. Yeah. Everyone else is seeing the slides?
Yes.
Okay.
Yeah.
Okay. So Wilms tumor is tumor in the kidney. It causes hypertension. Since there is cancer in the kidney and the kidney produce urine and there's cancer in the kidney, so the patient might bleed in the urine, so hematuria. So Wilms tumor cause hypertension, cause hematuria. Yes? Also, they might get infection because they are cancer cause low immunity. Any cancer cause low immunity, so that might be put the patient at risk of infection. So again, Wilms tumor is tumor in the kidney. Number one, don't touch the abdomen. Don't try to palpate the abdomen because it is tumor in the kidney. Once you press on it, the tumor it is very fragile, easy to spread. So never palpate the kidney or the abdomen. There will be enlarged abdomen, never palpate there. And there is high blood pressure. As we said, with all kidney disorder, there is high blood pressure. And since it is cancer in the kidney, cancer might bleed. So you expect hematuria, blood in urine with Wilms tumor. Since it is cancer, patient has low immunity, so there is risk of infection. This is Wilms tumor. Easy peasy?
Yes.
Okay. Then nephrotic syndrome. Nephrotic syndrome, the patient will start to retain fluid in their body. So they will not have, they will have oliguria. They will not pee much. Most of the fluid will be retained in their body with nephrotic syndrome. So they will have edema, like around the eye, they will have edema, especially in the morning. They will wake up with their face swollen, edema around their eye. So all the skin will be like swollen, right? So this swelling in the skin will make the skin so fragile. Imagine, I want to show you a picture of swelling in nephrotic syndrome. Have you seen it in your book or not yet?
Not
Okay, swelling. Okay, hi, Edward. So look at these images. Do you have class here?
Yes.
6 o'clock?
Yes. I came earlier. You weren't here.
I was in class with term 3. I was
That's
just
fine.
pulled suddenly.
Okay.
I really apologize.
Okay.
But tomorrow we can do 3 p.m.
3's too early.
What time you finish?
I get home like probably like about 3:40. I can be here like after 4:30 the latest.
Okay,
maybe.
let me finish this and we'll talk.
Okay. I sent you an email.
Okay.
Yeah.
Okay. So you guys, this is a nephrotic syndrome. Look at the face. Look at the face. Look at the swelling. Look how the skin is swollen in nephrotic syndrome. Look at this. Look at this guy. Look at the skin. How thin is the skin? So if I ask you your priority, did you see the face for nephrotic? Yes. So what will be your priority? Do you think priority care for nephrotic syndrome could be skin integrity?
Yes.
Yes.
Yeah. Yes, I will have, there is potential skin impairment. Yeah. So potential skin impairment should be your primary diagnosis. Yes. Because it's kidney problem, it will be hypertension also. Yeah. These people, they will lose protein. So nephrotic syndrome is the only kidney problem you give high protein diet. Because any kidney problem, we give low protein diet. Nephrotic syndrome only, we give high protein diet. Yes? So this is nephrotic. Make sure skin impairment is. Then glomerulonephritis. Glomerulonephritis, itis is inflammation. And it looks like there is deep inflammation in the kidney, in the glomerulus. So it is deep in the kidney. They also have hypertension. They have blood in urine. Yeah? What caused glomerulonephritis?
Inflammation of the glomerulus.
Wait.
Yes, Justin will tell us.
Is it a throat like strep?
Strep, very good job.
Yes.
Yes, Benny Carr also said strep. Good job. So glomerulonephritis is, scenario will be like this. 6 years old kid presented with sore throat. Started antibiotic, and then a week later, they started to have blood in urine. This is glomerulonephritis. This is a typical presentation of glomerulonephritis. After it will hit the kidney, the strep bacteria hit the kidney and cause glomerulonephritis. So it is severe deep infection in the kidney. We need bed rest. Make sure he's in bed rest and restrict fluid in glomerulonephritis. Okay, so these are the 3 diseases for genitourinary or renal. Got it?
Yes.
Mhm.
Then endocrine. Endocrine, let's focus on diabetes and thyroid diseases. Diabetes, please study this on your own. You know diabetes. You know what is ketoacidosis. You know what is DKA, right? Review that. I will not go there, but it is very important. And review the complication of diabetes. Review the retinopathy, review the nephropathy, review the neuropathy. So this is something I will leave you study on your own. Let's talk about thyroid problems. Newborn also, they have thyroid, right? Thyroid gland. For the newborn, I will focus more with hypothyroidism because it is commonly affecting newborn. Sometimes they born with low production of thyroid hormones. Thyroid hormones are very low. Yeah, they can born with it, could be congenital or could be acquired later in life. But since the thyroid gland does not produce enough thyroid hormone, what will be the treatment, guys? There's no enough thyroid hormone. What I'm gonna give? Send me on the chat. Levothyroxine. Yes, give Synthroid, give levothyroxine, because they are kids. If the thyroid function is not going back to normal or improved, they might get cognitive disorder. They will have mental impairment. They have physical impairment. So that levothyroxine has to be given for life to avoid permanent cognitive impairment. Crucial. You cannot stop giving thyroid hormones, levothyroxine, or the Synthroid for life because you're jeopardizing having them getting permanent cognitive disorder. Because thyroid gland help with metabolic rate. It makes them metabolize their food, it makes them grow, it makes them getting the energy, it makes their body function well. So any impairment of the thyroid function that cause cognitive impairment. Yeah? So this is endocrine, guys. Focus on diabetes. I will let you study this on your own and know your hypothyroid. Okay. We discussed the hematology last time. I will visit it later, but we did not discuss integumentary. Integ. Everyone now understand, like I go by system. Yes? And I highlighted the most important part in each system. So if we talk about integ, let's focus on scabies. Scabies, one of the integumentary problem. What is that? What kind of infection is scabies?
Parasitic?
Parasite.
Parasitic.
Yes, Justin, it's a parasite. The parasite will go under the skin, will dig in between the fingers, and it will cause these scars. And look at this, it bury under the skin. This is like the parasite, it lives there. So scabies cause severe itching. Itching mainly in the flexion area, like under the armpit, in the groin area, itching more at night, because at night the parasite will lay the eggs under the skin, and that will cause severe itching. How we treat this? Number one, hygiene. hygiene. Everyone in the family need to have their clothes, either to boil their clothes or iron your clothes. It is contact isolation precaution. If you deal with patient with scabies, it is contact isolation. It means you want to wear what? You want to wear your
Gown, glove.
yes, gown and the gloves. Treatment of scabies. We give ectomethrin or permethrin medications. It's a lotion. You apply it to the whole body except the head and the neck. So apply it to the whole body, leave it for how long? 10 hours or overnight. Yeah? Leave it 10
Yeah.
hours overnight, then wash it. Wash it. Also, they give capsules. We call it ivermectin tablets. This is one tablet. Patient will swallow the tablet. After 1 week, they will swallow one more tablet. So this is a treatment for scabies, plus hygiene. Everyone in the family need to keep the hygiene. Okay? Contact isolation precaution. Cool?
Sorry, what was the name of the pill that they take?
Ivermectin.
Ivermectin.
Let's put the subtitle. So they do ectomethrin or permethrin lotion, and they do ivermectin tablets. It doesn't write. Okay, here, I will write it. It is up, Katie, but I will write it in a clear. It is.
Thank you.
Sure. Ivermectin. It was written in the chat, in the subtitle. I opened the subtitle and it catched the name. Ivermectin. It's a tablet, they take it, and then after 1 week, they take one more. Then another integumentary is the people born with cleft lip, cleft palate, right? My main concern in cleft lip or cleft palate is rejection. The parent will reject the baby, how the baby will look. So my first patient care, I want to make sure there's a bond. I want to make sure there is no rejection from the parent side. Then let's talk about the treatment. It has to be surgically treated, either cleft lip or cleft palate. If it is not surgically treated early in life, how that affect the patient later on?
Body issues?
They will have
Body image
they will
issues?
body image for sure, yeah. But what about dentition? Are they going to have like good teething, good dentition? No, they will have bad dentition. They will have bad or faulty speech. They will not be able to speak clearly. The words will not come clearly. Yeah? So be careful with cleft lip, cleft palate. Your priority patient problem for parent could be the rejection. Also make sure they burp the newborn frequently during feeding. Because if they don't, because during feeding, because there is like cleft lip, cleft palate, they will swallow a lot of air. So you need to burp them more frequently because they swallow air. If the air is too much, they might vomit. Surgery is needed because faulty speech, faulty dentition is a risk. After surgery, make sure you give them to drink from a cup. Don't put dropper or don't put anything. They may need to get a cup so they will not hurt the stitches. Don't try to put any dropper inside the mouth or any spoon or anything inside the mouth because that might hurt the stitches. Give them to drink from a cup. Yep.
Yes.
This is integ.
Is there a question concerning time frame as to when the surgery is done on each one?
It should be before the first year. Before 6 months even. before they started teething, because they started to have teeth at 6 months. So it should be treated as early as possible. Okay, also you will get questions on safety like SIDS syndrome. Make sure the baby sleeps on their back, on their crib. Crib has very firm, thin mattress, no pillows, no covers, right? No smoking in the room. Yeah? Is SIDS more common in breastfed infant or bottle-fed infant?
Bottle
Bottle
fed? Bottle fed?
Bottle, yes, yes, very good. So SIDS is more common in bottle-fed infant, less risk on breastfed infant. Okay, so this is SIDS. Also, I want to make sure you know that safety, not only SIDS is safety, also car seat. How you place a child, like from birth up to 2 years, or if the newborn less than 40 pounds, rear facing. More than 40 pound, forward facing. From 40 to 65 pounds, it is, yes, booster seat. 13 years and older, put shoulder belt and lap belt. Very important, okay? Because they give you scenario and they will ask based on the pounds, based on the age, so know this. These medication, there is many medications here. I want you to review. I want you to know each medication. Review what is prednisone, what is fluticasone, levothyroxine, asthma inhaler like albuterol, digoxin, ferrous sulfate for iron deficiency anemia, thiophyllene for asthma, Accutane to treat acne. But if you're going to give Accutane, you need to have pregnancy test done first, because Accutane it is teratogenic. She cannot be pregnant while she's taking Accutane to treat her acne. Yeah?
Yes.
Okay. Question on the vaccines. What vaccines not administered until 12 months of age? You feel free, guys, to have a seat here.
live
What
vaccines.
vaccine?
Live vaccine. Live vaccine.
5 live vaccines, like what?
Measles, mumps, rubella.
Good job, Justin. Measles, mumps, and rubella. And here you go, guys. I give you a vaccine table. I know you struggle with vaccination, and I see you keep sharing vaccination documents, and this is a lot of things to remember. Please stick with this table. This is the shortest table you can find, and this is what you need for your exams, either class exam or even HESI or even your NCLEX. Was she able to fix it? No. So we will stick with the 21st?
Yeah, she said she'll talk to you more about it.
Okay. So it is as is. Okay, tomorrow 10 o'clock, and we will put a good plan.
Okay.
See you.
Thank you, Dr. Manal.
You're very welcome. Okay, guys, so this is the vaccination table. Please review, and you answered correctly. MMR, measles, mumps, rubella, it's a live vaccine, like Justin said. Also, varicella is a live vaccine. These two vaccines should not be taken before 12 months old. Okay, so this is what we did not discuss last time. We did not discuss integumentary. We did not discuss GI, so we discussed it today. And safety, like car seat, vaccination.
Dr.
So,
Manal, can you explain the mnemonic?
Hmm?
Can you explain the mnemonic for vaccination?
Absolutely. Okay. So there is class happening right now, so I need to go to my office. Give me 5 minutes, guys, and I will get back to you, okay? 5 minutes break, and we will continue.
Yes.
Okay, thank you.
Sure.
You smoke?
Okay, guys, let's get back. So I want to hear from you. What will be exam 3 on?
Cardio.
Number 1, cardio. Mm-hmm.
Respiratory.
Resp, big part on resp. Yeah.
Asthma.
And
Hematology, blood disorders, GI, endocrine. Okay. So we finished cardio, resp, hemat last time. But let's review because it's a big part. Let me give you a question here. Let me throw you a question on respiratory. Let me see how we do. I will give you many patients, 2 patients, like it's a priority question. Do you see that? It's a priority question. You have 2 patients here, and you tell me which patient you attend first. First patient, you have anxious patient with high fever, muffled voice, drooling, progressive respiratory distress. Then you have a second patient, it demonstrates hoarseness, nasal flaring, intercostal retraction, and the barking cough. Which one you need to see first? Number 1 or number 2? You put me on the chat. You said number 1. Why? If you say
Because
number 2.
The number 2 is like most likely like croup, and number 1 is like the progressive respiratory distress. So we need to do with the number 1 first.
Yes, number 2 is a croup. I agree. And this is emergency. Croup is emergency, right? But why you didn't choose croup and you chose number 1 over croup? Because you know barking cough is a croup. Yeah, and it is emergency too. It is also
it's a progressive. It's like progressive respiratory distress.
Progressive. The word progressive. And what is happening in the number 1? Drooling. So what is happening?
Drooling.
It's epiglottitis.
It is, Zach.
Yeah.
Is it Zach or Zaina? Yes, epiglottitis. What are the key words told you it is epiglottitis?
Drooling and then no
drooling.
Drooling, muffled voice, right? Progressive respiratory distress, right? So epiglottitis is airway. I like when you said airway before breathing. This is sign. Sign said airway because epiglottitis will block the airway. Croup is breathing issue, so I will go airway before breathing. If I don't have option 1 in the question, if I don't have the epiglottitis, I will consider croup is my priority. Yeah?
Yes.
Yes, both of them are very important. So remember what we reviewed about respiratory last time? Look here. In respiratory, we reviewed epiglottitis. We talked about respiratory distress syndrome. We talked about the prematurity, and they need to inject them surfactant, endotracheal surfactant. We talked about bronchopulmonary dysplasia. What is bronchopulmonary dysplasia? Bronchopulmonary means there is problem with bronchi and the lungs. Dysplasia means small in size, right? They are not formed appropriately. What is the main reason for bronchopulmonary dysplasia? What makes the kid born with small bronchi, small lungs?
If they're preterm.
Preterm, very good. Preterm. So how to prevent the bronchopulmonary dysplasia? Prevent the preterm labor. Make sure she give birth like on the due date, not preterm. Okay? Remember, if there is any quiet chest, sudden respiratory failure happen if there is no breath sound. So any disease, if sudden absence of breath sound, it is respiratory failure. Okay, so I have many notes here for you to review. For RESP, I have notes for croup, review this, especially the ones I put in red. Epiglottitis, review this. Yes. Tonsillectomy, post-operative care of after tonsillectomy. You need to give a codeine elixir. It is something to help with the pain after tonsillectomy. Give cold sips. Watch them for frequent swallowing, because if they are frequently swallowing, it means they might be bleeding. Observe for any distress or difficulty breathing. Then, here you guys, there is a case here. They tell you there is 5 years old, seen in the urgent care, with history and symptoms of sudden onset of severe sore throat after going to bed, difficulty swallowing, there is axillary temperature high, clear breath sound, absence of cough, child appear anxious, flushed, there is pus in the tonsil when they examine the pharynx. Based on these symptoms, what is the anticipating diagnosis? What do you think?
Ray syndrome?
Ray syndrome?
Because it goes from strep to...
Yeah, but this is a strep. This is a strep throat. When you have a strep throat, you will have fever, you will have sore throat. There is nothing wrong with your breath sound. Yeah, this is regular strep throat. What is the organism cause strep throat?
Streptococcus?
Yes, beta, group A, beta hemolytic streptococcus. Look at this. Group A, beta hemolytic streptococcus. It causes strep throat or pharyngitis. Strep throat, the other name is pharyngitis. Yes?
Yes.
Okay. And then we talked about asthma, which give expiratory wheezes. After steroid inhaler, rinse your mouth. For respiratory distress, endotracheal injection of surfactant. Yes? TB, guys, if there's a TB patient, place it in what isolation precaution?
Airborne.
Negative pressure?
Airborne and negative pressure room. Very good. Cystic fibrosis, guys. What is the pathology of cystic fibrosis? What happens?
Excess mucus?
Increase
high
mucus.
chloride.
Very good. High chloride, because mucus is full of chloride, so it will be thick mucus, right? So we need chest physiotherapy to loosen this thick mucus, and give pancreatic enzymes before meal, 30 minutes before meal. Give high calorie diet, low protein, and add salt. Okay. Give albuterol and give fat soluble vitamins. This is a treatment of cystic fibrosis. Albuterol and fat soluble vitamins. My computer will die. I will go get a charger, okay? I'll be back. Yeah. Okay, guys. So focused respiratory, guys, is heavy. Make sure you read all the notes in here and review Miss Tina's PowerPoint, review her study guide. Let's go cardio. Let's go cardio now. Meeting, but yeah.
You're gonna come with us tonight?
Oh, yes, at 6 o'clock. Yes.
Perfect. Carly is like to cleaner for student here. She has something to do with that.
Okay, I'll be there. Okay, so we will do review the cardio. Tell me the 4 findings in Fallot tetralogy, tetralogy of Fallot. What are the 4 findings?
Right?
4
So-
findings.
Almost stenosis.
Right ventricle.
Okay, remember to draw the D, R, O, and P. Yes, D4,
Yes. The
VSD,
okay.
R4, right
Right
ventricular
ventricular.
hypertrophy, O4,
Overriding of aorta.
E4,
Pulmonary
pulmonary.
stenosis.
You guys, do you think you will get exam on cardio and they will not ask you about these 4?
No way. No way.
No way, you will get this, okay? And remember the TET spills. In Fallot, there will be TET spills, right? So the child might be squatting, or you hold the child and flex the legs. Okay?
Mhm.
So, also remember, in general, infant with cardiac disease, they will be easy to get fatigue, tries out during feeding, so offer bottle feeding with big nipple, high calorie formula. If you give digoxin for the newborn, hold digoxin if pulse less than 100 beat per minute apical pulse. Clubbing might occur because of chronic hypoxia. Yeah? So, what disease caused blood pressure in the upper limb different than the lower limb?
Coarctation of the aorta.
Coarctation of the aorta. Which one is higher, upper or lower?
Upper.
Upper. What diagnostic or imaging show the structure of the heart?
Angiogram?
The structure, like it shows you the valves, the chambers. Echo. Echocardiography, guys. Echo. It's ultrasound on the heart. I want to remind you with ASD, VSD, PDA, we discussed that last time. I want you to remember that the 3 of them, they cause increased pulmonary blood flow. I explained that thoroughly last time, and I made it make sense. Okay? These 3 diseases cause increased pulmonary blood flow. Pulmonary congestion could happen because the blood recirculates back to the lungs. Yeah, this is cardio. Then hemat, but I need to attend to the weekend right now. For hematology, guys, please review the leukemia, hemophilia A, hemophilia B, sickle cell anemia, iron deficiency anemia, Hodgkin lymphoma. They are all in the slides, and I will share the slides, okay? But not right now. I will share it with Michaela. Michaela, I believe I have your email. And Michaela, you will take care of this, right? You send it to everyone. Michaela, what is your email? Or anybody, give me your email. Anybody? Fast.
She put it in the chat.
She put it in the chat. Let me go to the chat. Okay, we'll do this. I copy this address. I will send it all to you guys right now, okay? I have to go, but I will send the PowerPoint very soon, okay? And Michaela will get it, okay, guys?
Thank you so much.
I see you around.
Thank you so much, Dr. Manal.
Take care, guys.
Thank you, Dr. Manal.
You're welcome. Bye.
Bye.